Hello everybody, I'm Dr. Burness, and I run a concussion-focused chiropractic and functional neurology practice in Oakville, Ontario. Had a patient in this week that has a fairly common complaint, and when we did his examination, there's a very obvious sign or reason why he's having this complaint, so I thought I would go over it with everybody. So let's just get right into it. So this is a 40-year-old man who presented at my practice with nausea. He's had a concussion, as I said, in several months ago he had it, and he's been dealing with nausea daily, but worse so in the morning when he first wakes up. He's quite sick to his stomach, and he was looking for help for that particular complaint. So when we did our analysis with him, I'll just show it to you. So one of the things we did here when we were doing his workup is we put him on the VNG, which is measuring eye movements. And we use eye movements, volitional eye movements, reflexive eye movements to look at different areas of brain function. So anyway, this is the graph that comes up from his first test, which is a test called spontaneous nystagmus in the dark. So for this test, what we're doing is we have some goggles on him, and these are connected to computer, and they've got cameras in them, and they're just measuring his eye movements or recording his eye movements. And this first test is called spontaneous nystagmus in the dark. So what's happening is he has those goggles on, but they're blacked out, so he can't really see anything. So he's basically sitting in the dark, and the cameras over the eyes are recording the eyes. And along the bottom axis here is time. So the test runs for about 30 seconds, and on the vertical axis is position of the eye. And on this horizontal projection, the way you interpret this is when the line is going down, that means the eyes are moving to the left, and when the line's going up, that means the eyes are moving to the right. So we have a slow drift to the left and a fast beat to the right, and a slow drift to the left, fast beat to the right, and that's repeated over and over again. And if you want to see the video, we can see, you can actually see the movement. It's a little bit easier to see the fast phases, the resets to the right, but it's pretty obvious. And this sawtooth pattern, you see this repeated drifting in one direction and beat back to the other, is called a nystagmus, right? And in this case, this would be a right beating nystagmus. The nystagmuses are named by convention for the fast phase. So even though he's drifting longer to the right, it's the fast phase we name it for. So this is right beating nystagmus. And this is happening in the dark, right? So he doesn't know this is happening. He's got goggles on that are blacked out, so he can't see his environment. And if his eyes were open and they were doing this movement, if his eyes are drifting to the left, then he may anyway see that the room is drifting in the opposite direction, is drifting to the right as his eyes are going to the left. That would be his perception. So this type of an activity, these nystagmuses are vestibularly driven. They come from the balance system of the brain. And we're just seeing it in his eyes. So there's a vestibular injury of some sort here. And the injury could be in the inner ear on one side, in this case probably the left side since the eyes are being pushed to the left, but it could be in the brain stem on that side where that information from the ear is processed. It could be in the cerebellum on that side, or it could be in the cortex on the opposite side. So somewhere along this vestibular processing pathway, he's got a weakness of some sort. And just by way of explanation, the vestibular system, we have a right-sided inner ear, of course. We have a left-sided inner ear, and that information interprets your head movements and transmits it to your brain. And the way the system works is the right side and the left side are always firing. They always have a tonic output, and then when you move your head in a specific direction, the output increases to push your eyes in the opposite direction. And we have this vestibular ocular reflex so that we can keep our eyes on targets when we're moving around. Anytime you turn your head to the right, you fire that right horizontal canal in the inner ear, and it pushes your eyes to the left, and vice versa on the other side. And as long as those two systems, their tonic output is the same, then your eyes don't go anywhere, you don't feel like you're moving, and you feel balanced. In his case, his eyes are drifting to the left, so basically his brain is pushing his eyes as if his head would be turning to the right. So we have a higher output on the right than the left, drives the eyes to the left, and then they reset back to the center. And that's exactly what we see here in this pattern. And this is happening again in the dark. He's not aware of it. So the next question is, so he's doing this in the dark. So what happens when he's actually looking at a target? Does this happen all the time during the day, or is it only happening when his eyes are closed, or when he's in the dark like this test? So if we look at him, what's he doing during the day when his eyes are open and he's looking at targets? So that's what this one is showing. Again, those goggles are still on the head, but this time the shield's been removed, so he can actually see. He can see through the goggles to the target that's projected on the wall in front of him. So he's looking at a red dot on the wall. And to the left of this blue line, that dot is on, that laser is turned on, and you can see that his eyes are pretty steady. We don't see that pattern at all. But as soon as the light goes out and now he's just looking at a blank white wall, the pattern starts to reemerge. So he can control it when he's looking at a target, but when the target goes away, he's lost that feedback that the room is moving now, and the eyes start to reemerge again. So if there was something on the wall, if there was a picture on the wall or something there that he could notice, then he could control his eyes, because he's got some feedback. He could see that picture moving to the left as his eyes moving to the right. Sorry, as his eyes are moving to the left. But so he hasn't got that with the blank white wall. So we see that pattern reemerges. So this activity is going to be happening all night long. So when he's just like when he's in the dark with the goggles on, he has no feedback. So when he's sleeping in bed at night with his eyes closed, again, he's got no feedback, and the eyes are moving and driving this all night long for him. Now, just let me cue it back up again for us. So when this pattern is happening, like I say, eyes are moving left, beating back to the right. This particular thing is, as I said, it's happening as if he was turning to the right. And the muscles that move the eyes in this direction are in an area of the brainstem. Let me pull that up for us. So the vestibular system, this would be the inner ear. In this case, this would be the left-sided inner ear, and there's one on the right side here. It's just not shown in the picture. But anyway, this vestibular system is integrated in the brainstem, the pontomedullary brainstem. And there's other stuff in that area, but first of all, we said that the vestibular system pushes the eyes, and it pushes the eyes through these pathways. It's going to push the eyes in the other direction. So eye movements in the same area of the brainstem as this vestibular system. It's very close by. And also what's in that same area is control of the stomach and the digestive tract in general, and the heart and lungs. And anyway, so what tends to happen is if this system is constantly firing all night, pushing those eyes left, pushing those eyes left, pushing those eyes left, you fire up the whole area, and it starts to spill over into the areas that control stomach function and bowel function. And guess what? Now you're getting aberrant signals from the digestive tract, and you start to feel sick to your stomach. So that's what's happening for this patient. And it's not just that we see this with injury, right? I think everybody has experienced the point where they've spun around as a kid, or they've been on an amusement park ride or something, or even a long car trip for some of us that are a little more sensitive, and you get motion sick. And you're getting motion sick because of this exact same thing. The vestibular system is firing because of the movement of the ride or whatever you're on or you're spinning, and it winds up that area of the brainstem where the control of the stomach and the digestive tract is, and guess what? Now you start getting aberrant signals from the digestive tract, and you feel sick to your stomach. And that's what motion sickness is. And that's what this patient is feeling. He is basically motion sick. It's the same mechanism, except his is being driven by a vestibular imbalance rather than a vestibular stimulation like spinning in a chair or on an amusement park ride. So that's what's happening for him. And what needs to be done is we need to try and correct that. We want to try and find, okay, now where in his neurological system, where in the brain, the inner ear, wherever that injury is, can we make that stronger? Can we restore that output of tone from that left side and stop this imbalance from happening? And if we can do that, he'll feel a whole lot better. So that's basically what it comes down to. Again, there's lots of other things, of course, that can cause a person to feel sick to their stomach in the morning, but this one was fairly obvious. So hopefully that's informative and maybe helpful. So thanks for watching.